Good morning everyone. My name is Dr. Alpesh Waghela from Department of Orthodontics and Dentofacial Orthopedics in return from the Narsibai Patel Dental College and Hospital from Sakaj Patel University. Today's will lecture the discussion about development of dentition and occlusion. Here the introduction. The human dentition is a dynamic state of constantly change throughout the life, and the knowledge of this change as to inclination determine whether or not specific occlusion will be sustained and worsen and self-corrected over the time. Now, a period of the various development of occlusion, the pre-dentition stage, dentition stage, mixed dentition and the permanent dentition. This will be also divided in the various deeply part and various terminology we are learned in this specific period of the time. The pre-dentition stage from the birth to the 6th month of the age. Usually there is no teeth instead of the upper and lower gum pad always present. What is a gum pad? Gum pad are the covered with a dense fibrous connective tissue divided into segmental elevation representing teeth forming below. Now we can see the figures. Here we see the figures, the pre-dentition stage. The maxillary gum pad and the mandibular gum pad we see. Maxillary the horseshoe shape, the lower is a U shape is there. Dense fibrous connective tissue they are covered in the upper and lower gum. Here the pre-dentition stage. Here we can see the figure. Mostly this stage is a self-correcting also, and this one is a infantile open bite because of the upper and lower gum pad is attached in the posterior molar region. Anterior is open. This condition is an infantile open bite. This one is a normal and a helpful for the suckling. This one is a gingival cyst for the infancy. Parents should be reassured that will be spontaneously brushed and resolved within the first 3 months of the life, because here we see in the photographs occasionally on the alveolar mucosa small whitish nodules may appear. These are a gingival cyst also we can see in the infancy, often called the Epstein pearl and a Bohan's nodules. Now we can see the natal teeth and the neonatal teeth. What is a natal and the neonatal teeth? Very rarely seen are present in the birth is a natal teeth, and if they are erupt within 1 to 13 days, that's called a neonatal teeth. If what occur, if mostly located in the mandibular incisor region, and they are usually either mandibular incisor or a supernumerary teeth. If they are a mandibular incisor extract only if they are an interference in the breastfeeding, and if they are mobile and the swallowing by the infant. If risk is there, then it can be removed. Now a deciduous dentition stage from 6 months to 6 years age. This is the deciduous dentition. In the first tooth erupt in the mandibular central primary incisors. Normal, what a sequence of the eruption of the primary teeth? A, B, D, C, E. All the deciduous teeth should be erupted within 3 years, and the root is completed 1.5 years after the eruption. Features of the normal dentition. What we can see in the features of the mostly normal dentition in the deciduous teeth. So we generally see the spacing usually existed between a deciduous teeth. This space is called the developmental and the physiological space. Primate space seen in the mesial to the maxillary canine and distal to the mandibular canine. We can see in the second figure. We can also see the deep bite. Deep bite occur because of the deciduous teeth are angulation is less. We can see in the permanent teeth they are more angulated. So there is no deep bite is there. In deciduous teeth is a deep bite present. Deep bite reduces almost the age of the 5 to 6 years of age, because why they are relieved eruption of the deciduous molar, adhesion of the incisors, and the forward movement of a mandibular due to growth. Features of the normal deciduous dentition. First, terminal plane relationship. The distal edges of the upper and lower second deciduous molars are in the same vertical plane. This is called the first terminal plane. Now we can see in further the mesial step and the distal step, and mesial step and distal step how to convert class 1, class 2 endon and the class 3 molar relationship. Also The abnormal features is the eruption state, abnormal eruption sequence, no spacing in the crowding, no open bite, major step, distal step relationship, cross bite, premature loss of the deciduous tip, and infraocclusion primary molar we can see. Mixed dentition stage we can see from the 6 years to 12 years age. It is further divided first transitional, intertransitional, and second transitional phase. We can see in the various terminology for the orthodontic purpose. You have to understand in the first transitional, intertransitional, second transitional, various terminology there. First, like leeway space of Nance, early duckling stage, early major strip, late major strip. We can see in the various stage. First transitional stage characterized by the eruption of the permanent incisors and the permanent molar. The mandibular first molar usually in the first permanent tooth to erupt. Mandibular teeth usually erupt in the head of the maxillary incisor. Early major shift occur at this stage. First transitional stage, what we can see in a first transitional period, eruption of the incisor. Here time, the primary incisors, they are replaced by the permanent incisor. This terminology is the incisor liability. Now we are replacing in a what if figure we can see like a collective mesodistal dimension of the permanent incisors tooth crown are larger than the deciduous precedent. This is definitely no incisor liability, like a difference between them primary and the permanent incisor. This is incisor liability. If permanent is a larger compared to the primary teeth, so see what we can see like a maxillary is a 7 mm and a mandible is a 5 mm space. This is the incisor liability. First transitional stage, this can be corrected by, we can see the upper and lower photograph. Spacing present between the deciduous teeth, labial eruption of the permanent incisors. Also we can see transfer, increase intercanine width. We can see the changes like this. Deciduous canine also distally into the primate space and part of the leeway space. First transitional stage, eruption of the first permanent molar. Initially, occlusal relationship of first molar is directly influenced by the deciduous second molar position. In teeth are flush in the terminal plane, then the first permanent molar assume a cusp-to-cusp relationship when they erupt. In order to establish a class 1 molar relationship, some mesial movement of the mandibular first permanent molar will be required. Here the see the photograph, first terminal plane, and how to convert a class 2 a class 1 molar relationship we can see. Early mesial shift, first terminal plane, class 1 can be obtained by utilizing the primate space and is called the early mesial shift. First transitional stage, mesial step convert to the class 1 and the class 3 molar relationship. The minimum mandibular growth we can say the class 1 and a severe mandibular growth might be converted to the class 2 and the requirement for the space also. Distal step, they are converted to the class 2 and the endol molar relationship, requirement of the leeway space and the mandibular growth. Normal features of the first transitional stage, transient lower mandibular incisor is a crowding, transient anterior open bite before the eruption of the permanent incisors, and a cusp-to-cusp permanent first molar relationship when they are first erupt and before early major shift take place. And now we are go ahead for the intertransitional stage and what changes occur in the intertransitional stage. We have also learned for the first transitional phase. Intertransitional stage are characterized by the presence of the all permanent incisors, the first permanent molar and the deciduous molars and canine. This phase is relatively stable and no changes occur. Here we can see the most important points of the ugly duckling stage. Another name of the ugly duckling stage is self-correcting malocclusion, transient malocclusion and broadband phenomena. This is a synonym is there. Ugly duckling stage is a developmental stage occur at this stage. Now we can see the what changes occur and what is the ugly duckling stage, broadband phenomena, self-correcting malocclusion is there. So here we can see the figures. Here we can see the figure. First we see the 2 mm space more than that. So this is the ugly duckling stage in the midline diastema present in the 2 central incisors. And here the radiographic we can see. So what changes occur? Now we are go ahead. Mostly we are understanding the what is ugly duckling stage. During the 7 to 8 years age, starting the development of the canine. canine erupting, they are exerted pressure of the lateral incisor root. They are transmitted pressure from the central incisor root. Roots are a mesial movement and a crown inclination of the distal side. So inclination of the lateral incisor at distal side, also distal side of the central incisor, and they are a created space between to the central incisor. So here the stage is a ugly duckling stage. Then up to the 11 to 12 years age, the maxillary canine is a properly erupted in the occlusion area. That time that the pressure relieved and exerted from the occlusion side, all the pressure and normal, then space is a closed. This is a self-correcting malocclusion because of the we are not corrected because of during the treatment, but they are corrected itself. That's why the self-correcting malocclusion. Broadband is inverted. This is a broadband phenomena. And third one, transient is a, like a this space, intertransitional space we can see. So this is a transient malocclusion. And last one, we can see the ugly duckling stage because that time patient took a ugly, so that name is a ugly duckling stage. Second transitional stage, characterized by the eruption of the premolar canine teeth, normally take place is a 9 to 12 years age. In the mandibular, canine erupts ahead to the first premolar and is followed by the second premolar. In this maxilla, first premolar usually erupt the first, followed by the second premolar and the canine. Late major shift occur at this stage. We have seen the late major shift. Usually the anterior teeth, permanent premolar, smaller than the primary teeth. The extra space is known as a leeway space. Here, what is a leeway space is then? We can see the figures also. Permanent canine, first and second premolar, and the deciduous canine, first and second molar, space discrepancy between them. So this is the leeway space of nails. Leeway space is a larger in mandible, like a 1.7 each are. Right side is a 1.7, opposite side 1.7 is a totally 3.4 mm, and in also the maxilla is 0.91 mm, 0.9 opposite side is a 1.8 total mm. Here the discrepancy difference between them, the first molar to move a greater distance, lower arch compared to the upper and reading is a class 1 relationship. It is known as the late major shift. Here the photographs, we can see the late major shift. Permanent dentition start after the exfoliation of the last deciduous tooth, usually the upper second deciduous molar. The sequence of the eruption is as follow in maxillary arch 6, 1, 2, 4, 3, 5 and 7, or is the another is a 6, 1, 2, 4, 5, 3, 7. In mandible 6, 1, 2, 3, 4, 5, 7, else 6, 1, 2, 4, 3, 5, 7 according to vary of the patient. Normal permanent dentition, we can see the presence of all permanent teeth, class 1 molar canine and incisor relationship, well aligned teeth with corrected crown angulation and inclination, normal and a positive overjet and overbite 2 to 2 mm, absence of rotation, tight interproximal contact is there, flat cosp and the correct tooth size ratio. We can see this is the various references. Thank you. Thank you everyone.